Obtain sterile mouth mirror, air water syringe, 2x2 gauze, suction tip, cotton tipped applicator, periodontal probe, barriered pin, and patient's chart. Provides patient with protective eyewear and patient napkin. Ask the patient to remove dentures and lipstick.
Do you have any removable appliances in your mouth?
No.
Okay, perfect.
Communicates procedure and the rationale for performing an intraoral examination to the patient and asks about past history of lesions and any areas of tenderness during the palpation exam.
Courtney, today I'm going to be performing an intraoral exam. I'm going to be checking all of your tissues for anything that's abnormal. Have you ever had any history of any lesions?
No, but I have a canker sore right now.
Okay, where is that?
It's just on my lip.
Okay, I'll be very careful and I'll take a closer look at that as I get inside. And as I'm doing this intraoral exam, will you let me know if anything's tender as I'm doing it?
Yeah.
Thank you.
Places patient in a supine position. Illuminates all structures with operatory light while examining. And uses cotton tip applicator to point to structures. Practices good ergonomics throughout the procedure. Visually examines the lips, both open and closed.
Go ahead and open for me and close. Perfect, thank you.
Including the vermilion border, the philtrum, and the labial commenters.
Open again. Great. Thank you.
Visually inspects the entire oral cavity and oral pharynx for any abnormalities and or lesions, including the maxillary tuberosities.
Open big for me. Good. And now to the other side. Great.
So including the maxillary tuberosities,
And turn towards me.
retromolar pads, and gingiva.
Open big, thank you.
And note how she uses her mirror to make sure she looks at the lingual gingiva as well. Retracts lips with index fingers placed intraorally and thumbs placed extraorally, and visually examines labial mucosa and related structures, including vestibule.
The vestibule is this space right here.
Frena,
This is the labial frena.
and alveolar mucosa.
And alveolar mucosa is here. And I will repeat on both sides of the top and also on the bottom, pulling up and away for the maxilla and down and away for the mandible. I do see your abscess ulcer there.
Retracts cheeks with index fingers placed intraorally and thumbs placed extraorally, and visually examines buccal mucosa and related structures, including the linea alba.
I'm going to have you turn a little bit towards me, Courtney. Thank you. I'm going to look on there. So the linea alba is this white line right here.
Parotid papilla,
Parotid papilla is right here.
and the Stenson's duct is on there as well.
And the Stenson's duct is where the saliva comes out right there. I will repeat this on the other side. I'm going to have you turn away from me. Thank you so much. I'm going to check all of the buccal mucosa. And I note the linea alba on this side, the parotid papilla, and the Stenson's duct.
Then we're going to palpate the lower lip with index fingers placed intraorally and thumbs placed extraorally using compression technique. And then bimanually palpates the right cheek using the index finger of the right hand and middle and ring finger of the left hand to avoid wiping saliva on the patient's extraoral tissues. For left-handed clinicians, this will be opposite.
And I would like to note that this is a wide area, so you're going to kind of do one one full swipe and then go back further, and you'll do the same, keeping one finger stationary and one finger moving so you can feel any lesions.
And then
go ahead. Sorry.
we'll palpate the upper lip and left cheek using the same techniques previously described. Right, and then we're going to move on to examination of the floor of the mouth. We're going to instruct the patient to tilt their chin down, open wide, and place the tongue to the roof of his or her mouth. We're going to visually examine the floor of the mouth and related structures, including the ventral of the tongue, the lingual veins,
These are the lingual veins.
the fimbriated folds,
Fimbriated folds are right on both sides. You can see those folds.
the lingual frenum, the Wharton's duct, which is on the sublingual caruncles,
Which are on both sides here, and the duct comes out right at the tip there.
and the sublingual folds. Then we'll bimanually palpate the floor of the mouth by placing the index finger of the right hand on the floor of the mouth and having the patient relax the tongue and closing slightly,
Relax your tongue and close slightly, thank you.
and then place the middle and ring finger of the other hand under the chin. You're going to press upward with the extra-oral fingers and downward with the intra-oral fingers. Begin in the right posterior section and then move anterior and continue to the left posterior section, just as she did. Next, we'll move on to the examination of the salivary glands. We're going to check the salivary flow of the right and left submandibular gland by evaluating the Wharton's duct. We're going to instruct the patient to touch their tongue to the roof of their mouth and use a 2x2 gauze square to dry the sublingual caruncles and sublingual folds. Then, using a cotton tip applicator, we're going to press down lightly in the region of the sublingual caruncles and repeat until a drop or stream of saliva is expressed.
I don't know if the video caught it, but saliva just came out.
Good. And then next we'll move to check the salivary flow of the right and left parotid gland by evaluating the Stinson's ducts. Instruct the patient to open halfway and retract the right cheek.
Turn a little bit towards me, thank you.
We're going to use a 2x2 gauze square to dry the parotid papilla and use a cotton tip applicator to apply gentle pressure.
Oh, there we go already.
Begin above the parotid papilla and roll down toward the parotid papilla and repeat until a drop or stream of saliva is expressed.
And I will repeat this on the other side. A tip for this area is to dry with, go ahead and turn away from me, Courtney, thank you. So dry with gauze. Don't turn away because sometimes you miss the saliva expressing. And then roll down. There we go.
Okay, then we'll move on to examination of the tongue. So we're going to visually examine the dorsal surface of the tongue.
And you stick your tongue straight out.
And here we'll be pointing out the filiform papilla,
Those are the little white ones that fill in the whole area of the tongue.
the fungiform papilla,
Those are the larger mushroom-shaped red ones you see here.
the circumvallate papilla,
And those are all the way in the back. She has great ones. They form a V in the very back.
and then the foliate papilla.
I'm gonna have you stick your tongue out towards me. Those are along the side, these slit-like papilla. And let me check the other side. Right here. Thank you.
Good. Then we'll examine the lateral surfaces of the tongue and the posterior floor of the mouth by wrapping a folded 2x2 gauze square around the tip of the tongue
And you stick your tongue straight out.
and gently grasping and pulling the tongue forward and side to side.
It is important to lift up and then out to not hurt their lingual frena as you do this. I'm going to pull it to the side as I check this. I'm going to check the lateral border of the tongue and the floor of the mouth on this side. I'm going to do the same lift up and over. I'm going to use the back of my mirror to examine the lateral side on this side and the floor of the mouth.
And then while grasping the tongue with gauze, you're going to use the dental mirror to examine the posterior lateral surface of the tongue.
Which we want you to do at the same time as I just did.
Good. And then we will bidigitally palpate the tongue.
I'm going to have you stick your tongue out. Next,
we'll examine the hard palate, tonsils, and oral pharynx. We're going to instruct the patient to tilt their chin up and open the mouth wide. Using a mouth mirror for indirect vision and illumination, we'll visually examine the palate and oral pharynx and related structures, including the incisive papilla, palatine raphe,
That runs straight down the middle.
and palatine rugae.
Those run transverse.
And then for posterior structures, we'll apply moderate pressure to the posterior tongue in a downward and forward direction with the front surface of the mirror and instruct the patient to say ah.
Ah.
And we'll be looking for the soft palate, the uvula,
Say ah one more time.
Ah.
the palatine tonsils,
Which are right in between the anterior and posterior tonsillar pillars.
Perfect. And then once we visualized all of that, we will digitally palpate the hard palate using the index finger, making sure not to drag the finger across the palate.
I will recognize abnormal conditions including swelling, trauma, lesions, lumps, areas of hardness, tenderness, pain, or inability to express saliva. I will document abnormalities on my assessment form, including the anatomical location, the border, color, consistency, configuration, diameter, type, and texture. Include the history and any other descriptive terms. I will use my clinic manual for guidance. After a CI checks, I will transfer my findings from my assessment form to my treatment record. For any suspicious lesions, I will ask the patient to return in 14 days to re-examine that. If it is still there, I will give the patient a referral for a biopsy, including all the appropriate signatures.